Good day, class. In this video, we are going to continue the discussion on qi disorders. In the previous video, we have introduced 4 different types of some qi deficiency syndromes: qi deficiency, qi thinking, qi insecurity, and qi collapse. These 4 different syndromes are considered as deficiency syndromes of the qi disorder. These 4 also develop from the previous one, so they just become worse and worse. In this video, we're going to introduce another 3 excessive syndromes in qi disorder. So first one is qi stagnation. Qi stagnation means the objective qi circulation in certain parts of the body. So which means the movement of the qi in the organs or in the meridian is not smooth. So the movements we have problems. The manifestations can be pains. What kinds of pains? Distension. So distending pain. This pain is distending pain. Or the patient don't feel pain, but they can feel distension. The reason is stagnation. Now I want you to think about in one tube or in one room or an object. Did something move inside the tube and now something blocked somewhere? The volume of the stuff goes in still the same. So which means you increase the substance in the tube. You increase the volume here. Now you can imagine the pressures on the wall of this tube. What kinds of feeding? You increase the pressure of the walls of the tube, right? That's distending from the walls of the tube. You can feel distending. That's why qi stagnation. The most typical symptoms, the most typical manifestations is distending. It can be distending pains or just distending. The distension, this also can happens in, or more likely happens in ladies, such as from some ladies, you may experience breast distension before the period. So during your cycle, the whole month cycle, you feel fine, but just before the period, before the 7 days period. Around here, a few days before, you start feel distension in your breast, and then you knew that the period is coming. Why you will feel distension before the period? That's because of the qi stagnation. In this situation, the qi stagnation can be normal, also can be abnormal manifestation. Why it can be normal? That's because in your meridian, in the channels of where the qi moves, or it can be a meridian, it can be sanjiao, anywhere in the body where the qi moves. The pathway where the qi moves, you got certain amounts of qi and blood move in the pathways. So these pathways can be meridians or sanjiao. But now you can just imagine, before the period, you got more qi and blood. So which means you increase the volume in the same pathways. So this is very similar, the highway in Joburg, the N1 and M1. Normally, we have certain amounts of the cars drive on M1, but you can see at the peak hours, the traffic, you got more traffic in the same on the same highway, and the car becomes slower because of the stagnation. The slower the stagnation will cause slower, will affect the circulation. So the same highway, you got more cars on. The same meridian, you got more qi and blood in. That's why you have this tension or distending feeling in the breast. So that's the qi stagnation. The pain can be distending or migratory. Why the pain can move? Because qi is foundless. So something foundless, they can move to other area. No massive. That's also because of qi is not formed. This is compared with the blood stasis. The pulse is wiry. That's also because the qi stagnation mostly, in most conditions, it is related to the liver. The wiry pulse is related to the liver. The cause of qi stagnation, it can be emotion, emotion problems. So that's the internal evils, such as the excessive grief, depression, overthinking. These all can cause qi stagnation. The second is the phlegm, blastasis, or food retention. Parasites in the body also can cause blockage. Can be physically blockage that we can see, or some blockage although we can't see, such as the phlegm block in the meridian. We cannot see, but we can see from the manifestations. Something we can see, such as the parasites or stones in the body. It also can be due to coldness, dampness, cause blockage in the meridians or organs. So no matter what kinds of causes, it must cause the movement. It must obstruct the circulation. So in future, you will see that the qi stagnation. When we talk about the zangfu organs, you see that mostly it can be liver qi stagnation, stomach qi stagnation, or liver and stomach qi stagnation. The manifestation will link to these organs. The key point is tension. Qi counterflow. Qi counterflow means of adverse ascending of qi. The qi is supposed to move downwards, but now it moves outwards. That's the counterflow. What happens if the qi counterflows? In the lung, it can present as cough, panting. That's the qi supposed to go down, goes deep to the lung, but now it becomes very shallow. It's supposed to go down and up. Now it only goes a little bit. So in a normal condition, our breathing, the qi goes down into the lung and goes up out of the lung. The volume is similar, but now counterflow. Because the qi still move down, but when they move more, that's counterflow. When they move more outwards, this part become cough. or asthma, difficult breathing, panting. So that's in the lung. It also can happen in the stomach, such as nausea, vomiting. That's also the qi supposed to go downwards, but now it goes upwards. Dizziness, headache. What kinds of feeling does the patient will have? Also distending, because they got excessive qi move to the head. The qi needs to go to the head. A certain amount of qi, we don't want too much. Now they have too much qi go to the head. They'll become the headache, block the meridian, because block the circulation, vertigo, dizziness. So that's the qi counterflow. When you diagnose or when you think about qi counterflow, you just need to remember what's the normal situation of the qi. Where in a healthy situation, where does the qi supposed to go to? Now you can diagnose the counterflow. That's why the key points are coughing and panting, vomiting and hiccups, or even nausea, headache or vertigo. Especially for coughing and panting, nausea and vomiting, because these manifestations are very obvious of the counterflow. Headache and vertigo, you can, but in other symptoms, you also can see these manifestations. So when a patient presents with headache, it won't help you to diagnose counterflow. But a patient presents with difficult breathing, with coughing or vomiting, you know that's the counterflow of the stomach qi or the lung qi. It also can be the counterflow of the liver qi for vomiting. Why? While the vomiting also can be the counterflow of the liver qi. So in this statement, I skip one artifact in the middle. Qi counterflow from the liver can affect the qi in the stomach and then results in nausea or vomiting. That's why I said the qi counterflow of the liver also can result in vomiting, because the earth can affect the earth. That's the vomiting and nausea. That's the manifestations of the earth. So in a common situation, the counterflow is more related to the lung, the stomach, and the liver. When a liver counterflow, it can present as vomiting. It also can present as headache. The last one, qi blockage of the qi disorders. The counterflow or the stagnation, which just says that the qi moves slower, such as the stagnation. The qi moves slower but still moving. Qi blockage means something blocked, so it even stop. This can result in more severe condition. That's why it can be unconsciousness, especially the blockage in 脏腑 organs. Unconsciousness, that's the qi blockage in the heart, because consciousness is related to the mental problem, to the mind, that's the heart. Colic pain, qi blockage, the patient will present excessive and forceful pulse. And deep. Why deep, not superficial? That's because the blockage normally happens in interior. So qi blockage, the key diagnostic the key manifestations, the patient may have colic pain, the patient can have fainting or become unconsciousness. That's the key points of the qi blockage. These are different manifestations of the qi disorder. There's a patient that he feels discomfort, he feels this tending pain, and this pain can be relieved, such as the bowel movement, or the pain can be relieved by signing. So he prefers signing when in the conversation. You always feel or you always hear that he was signing. So after a few minutes, you can hear that the patient. So this kind of sound, the signing, the patient keeps signing because after signing he feels better. From this manifestation, how do you diagnose? What's the possible symptoms? The signing is the qi. So after relieving the qi in certain area or in the body, the patient can feel better. So that's, in other words, it can be the qi stagnation. Because the qi stagnation, we mentioned that it can be excessive qi in the body. It can be a pathological excessive qi in the body. So after signing or the bowel movement, the patient can feel better because after these activities or these movements, the patient actually relieved the qi in the body, reduce the volume of the qi in the body. That's why they feel better. And from this manifestation, you also can prove that this might be qi stagnation. So that's how to analyze manifestations in the to analyze the manifestations in the daily life or also in the clinical manifestations. The next one we are going to introduce the blood disorders. We're going to introduce two types of deficiency syndromes of the blood disorders. The first one is the blood deficiency. The blood deficiency, similarly to the qi disorder, qi deficiency, we don't have enough volume of the blood in the body. So in order to understand the manifestations of this syndrome, we need to remember the function of the blood, nourish the 脏腑 organs, meridian, and tissues. So the deficiency will result in malnourishment of 脏腑 organs. That's why the patient can present with a lot of different manifestations, such as palpitation, dream disturbed sleeping, or poor memories. These are due to the blood deficiency. The blood fails to nourish the heart. So the patient can present with blood deficiency, palpitation, dream disturbed sleeping, poor memory. The patient also can present with blurred vision, dry eyes. That's due to the malnourishment of the liver. The patient can feel numbness in the hands or feet. That's the malnourishment of the tissues, blood tissues. The patient also will have pale complexion, pale eyelid, pale lips, pale tongue, pale fingernails, pale. This is because we don't have enough blood in the body. The red color is the color of the blood. So on the other hand, if we don't have enough blood, we don't have red color in the body. That's why pale. Blood deficiency in ladies. They also can present a scanty menstruation because they don't have enough blood. They also don't have enough blood in the period. The blood in pale color, so pale red, not deep red. Delay the period. It comes every 2 or 3 months, or even amenorrhea. So from the manifestation, we focus on the function of the blood, and then you think about in different organs. It can manifest as different symptoms. The key points: pale complexion, pale in all of the body. Can be the lips, can be the tongue, can be eyelid. That's the manifestations of the blood deficiency. The patient also can present with fatigue. The reason is in a blood deficiency syndrome, the patient won't have sufficient qi. So these two always happens together. Why the patient will have insufficient qi? That's from the relationship between qi and blood. So in order to diagnose the blood deficiency, the most importantly is the pale complexion. The color is not only from the facial complexion, can be let's use other words, a pale signs. It can be all over the body, pale. The next one is the blood collapse. Blood collapse is similarly to the qi collapse, critical condition due to sudden excessive bleeding. It also can be chronic repeated bleeding. Blood deficiency means we don't have enough blood. Blood collapse refers to we have even less blood in the body. So it also can present as pale, dizziness, blurred vision. So you will see these are very similar to the blood deficiency. Also pale tongue. How to diagnose the blood collapse? When although here we only mentioned some of the symptoms, if you add the symptoms from the blood deficiency to the blood collapse, you also correct. The reason is because blood collapse must be blood deficiency. So blood deficiency is the foundation. Blood collapse a patient with blood collapse must have blood deficiency, because blood collapse is the worst condition of the blood deficiency. So the manifestations will be similar, but how to diagnose it for blood collapse? The patient will have a history of severe blood loss. So this is the key diagnostic points. Also, the key manifestations is the pale complexion. Also pale, weak, or hollowed pulse. So when we study the pulse sounds, the pulse diagnosis, we also talk about the pulse, the hollow pulse. What's the cause of the hollow pulse? Also blood. We don't have enough blood. Qi collapse, blood collapse. In future, we also going to study the yin collapse and yang collapse. These four collapse are all critical conditions, severe condition, and sometimes these, although from the manifestations we identify them clearly, sometimes they happen together. So sometimes it's very difficult to identify clearly in clinics. The reason also because blood collapse also will combine with the qi collapse because the blood is the carrier of the qi. Qi collapse also will result in blood collapse because qi loses the function to confine the blood. So qi collapse also will cause bleeding. And qi and blood, when we talk about yin and yang disorders, you will see that we also include these two because qi collapse is also considered as yang collapse. Blood collapse is considered as yin collapse. So these four collapses are similar and sometimes happens together. So when you see this kind of critical condition, you will know that this is a severe condition of the very severe condition in the clinics. In the blood collapse, in the manifestations, we also mentioned that the patient may present with cold lumps or cold extremities. Some of you may still remember that when we talk about the qi collapse, we have mentioned that the cold extremities. But why in the blood collapse, the patient also will have cold extremities? That's because the blood collapse always accompanied by the qi collapse. So this is the cold extremities due to two reasons. One is in the blood collapse, the patient will have poor circulation, especially poor circulation in the extremities, because the limited blood will circulate in the organs to protect the more important organs. So this will result in the cold extremities. The second reason is the qi collapse is accompanied with the blood collapse. The blood collapse with the qi collapse, and then the qi loses the function of the warming function. This also will result in the cold extremities. So that's the two reasons for the cold extremities. So these are the examples of the blood deficiency syndrome. Try to apply the theories in this way, and then that can help you to understand clinical manifestations. Thank you for your attention.